चुनाव के समय मैंने गारंटी दी थी कि तीसरे कार्यकाल में 70 वर्ष से ऊपर के सभी बुजुर्गों को आयुष्मान योजना के दायरे में लाया जाएगा। आज धन्वंतरी जयंती पर ये गारंटी पूरी हो रही है। अब 70 वर्ष से अधिक उम्र के देश के हर बुजुर्ग को अस्पताल में मुफ्त इलाज मिलेगा। सरकार का प्रयास है कि देश के हर बुजुर्ग जिनकी आयु 70 वर्ष के ऊपर है, उनको जल्द से जल्द आयुष्मान वय वंदना कार्ड मिले। और ये ऐसी योजना है जिसमें आय की कोई पाबंदी नहीं। गरीब हो, मध्यम वर्ग का परिवार हो, उच्च वर्ग का परिवार हो, हर कोई इसका लाभार्थी बन सकता है।
In a big move, the Union government has decided to expand the Ayushman Bharat health insurance scheme to cover all citizens who are above the age of 70 in India. Basically, income level restrictions have been removed and all senior citizens will now get medical coverage. Earlier, the scheme catered to the economically disadvantaged and covered 40% of the population. Now, 6 crore more people from over 4.5 crore families are included in this umbrella. This marks a significant shift in India's public healthcare landscape and is a bid to address growing healthcare needs in the face of rising medical costs. This may help ease the anxiety of India's aging citizens who find it hard to manage disease burden due to high costs without a social security net. As per the government, this move is essential as India shifts towards nuclear families and there's more financial burden on elderly individuals. So now each beneficiary who's over 70 years will get a new health card through which they can get access to healthcare benefits. Here are some of the important features of the revised scheme. All age 70 and above will be eligible for 5 lakh rupee health coverage, which is applicable on a family basis. This means that many senior citizens, if they are in the same family, are eligible. The 5 lakh coverage is divided among them. Even right now, the scheme is income-based and all members of eligible families get 5 lakh annual shared coverage. So the amount is still split between all members of a family. But now, even those senior citizens who are already covered under the scheme on the basis of family income, they will get an additional 5 lakh rupee top-up, which is specifically for their own use. Then, those senior citizens who are already enrolled in other public health insurance schemes like the CGHS for central government employees, ECHS for ex-servicemen, and other such schemes will have to choose between the existing plans and the expanded Ayushman Bharat scheme. Those who have private health insurance, however, can avail of the scheme benefits without it conflicting with their existing coverage. So now what exactly does the Ayushman Bharat scheme in itself cover? It basically provides secondary and tertiary hospitalization to 55 crore people, and now of course the net will be increased. It covers pre-hospitalization costs up to 3 days and post up to 15 days. It also covers non-critical illnesses. Things like lung cancer, stroke and paralysis are not included. OPD and home treatments are not covered either. Most private health insurance plans start from about 2,000 rupees per month and currently have a broader range as opposed to the Ayushman Bharat scheme. Also, while private insurance includes a large network of empaneled private hospitals, Ayushman Bharat includes both private and public government hospitals. The central and state governments pay the insurance premiums in a 60-40 ratio. The initial outlay of this scheme will be 3,437 crore rupees. The government says that as demand increases, the coverage will also be increased. As per reports, while most states will foot 40% of the bill like they are now, for hilly regions and the northeast, the centre will bear 90% of the cost. As per estimates, the cost of expanding the coverage to everyone above the age of 70 will be higher than covering the poorest 40% across all age groups. This because of their higher medical needs, and this amount is only going to grow. As per studies, India's population above the age of 60 will increase from 8.6% in 2011 to 19.5% by 2050. Currently, health coverage in this group is estimated at about 20%. And thanks to the expansion of this scheme, this coverage should rise multifold in the months to come. Hope you found this video informative. For more such content, keep watching Mint.